Welcome to GetWellNetwork's webinar. Today we're going to be talking about how hospitals and health systems can reignite growth in their organizations while at the same time addressing the new surge volume that we're starting to see in some markets. To briefly introduce myself, my name is Whitney Akers. I am a senior director on GetWellNetwork's strategy team. I've been with the company for a little over 3 years, and prior to that I was working at the advisory board company focused on population health. Since COVID-19 hit in March, my primary focus has been on really tracking the developing COVID-19 response strategy at hospitals and health systems across the country, and then using that information to guide our internal strategy for supporting our clients. I am excited for the opportunity to present some of the work that I've been doing, and I appreciate you taking the time to listen. So let's get started. I'd actually like to start the discussion today just by saying thank you. These are really difficult times, and the work that you're doing to help the community stay safe is so appreciated. Like all of our hospital partners, we've spent the last 4 months in rapid response mode too, and it has been a true honor to have the opportunity to work alongside some of you. And as you can see on the slide, we have some amazing partners. Our team, in partnership with these folks, supported over 200 hospitals and 100,000 patients since March in navigating the pandemic, and the response was amazing. So 90% of patients invited to use our digital care management tool for COVID monitoring and management are engaging with the solution, so amazing adoption. And 77% of those reported that this solution saved them from having to call or visit their doctor, which of course helped prevent infection and also freed up those care teams for patients that needed more intense care. Organizations are also being reimbursed for use of this solution between $20 and $80 per patient, which has been extremely helpful given the financial challenges that the pandemic has caused. And because of that added reimbursement, if you look to the far right, our partners who used the solution were able to offset their total COVID-19 care costs by about 50%. The final thing I'll mention before we get into the rest of the content is that we were also able to partner with our clients to reach underserved and minority populations in a really meaningful way. African Americans were 15% more active with the content than other racial groups, which is obviously so important, just given the disproportionately high spread of infection in minority communities. So that's something we're really proud of and humbled by as well. So again, thank you. We're honored to have been a part of the effort, and we thank you for all of your hard work. We can go ahead and dive into kind of the meat of the content. There are 2 items on my agenda for the discussion. I'll first kick us off with some insights around the current landscape, what lessons we learned, and hopefully provide a useful framework for how you should think about your strategy moving forward. And then from there, I will transition over to share some details on the work that our team is doing, that our clients are doing together to support the effort. So let's get started. So a lot has happened in the last 4 months, and obviously the landscape is still shifting. What you see on the screen are some of the things that we are hearing across the country today. Some of these concerns and questions are very forward-looking, things like, how much should we invest in remote care? How should we be thinking about competition and new competitive forces? And then other things that we are hearing are more immediate. So, how do we get our volumes back up, given ongoing patient fear, patient financial challenges? What do we do about test shortages? That's something that's coming up more recently. And then maybe most pressing, how do we strategically manage surges and everything that comes along with that? And if I was going to map these concerns out, here is what I would say that looks like from a strategy and priorities perspective over time. So until recently, there had been really 2 response phases. So the first I'm going to call active crisis management. And during this phase, the primary objective was to mitigate capacity overload. Organizations were scrambling to keep as many patients at home as possible, as you know, to reduce the spread and make sure that there were enough resources to respond in the event of a surge. And then, as states shut down, social distancing started to rise and slow the spread. hospitals began to kind of reopen. And this is where we enter that reopening and recovery phase. And here, the primary goal became to quickly increase service volumes. We've got to recover all of that lost revenue, particularly in high margin areas like elective surgeries. And a big focus was, making sure that patients were reassured that it was actually safe to be back in the care setting. And while those volumes have not completely recovered, we are starting to see less patients delaying care. They are starting to increase. The other focus during that recovery phase was thinking about and preparing for the future. So, the pandemic has changed the way that we provide care forever. I don't think anybody's arguing that. Patients have new expectations. They've been exposed to remote care. The regulatory environment around remote care reimbursement is likely to change or predicted to change. And so organizations are spending a lot of time right now across this reopening and recovery period thinking about and determining, what are the investments that make the most sense. Now, enter surges. So this is a headline on the far right from the Wall Street Journal 2 days ago. As US surge in coronavirus cases continue, some states tighten rules. So, obviously we're starting to see this spike throughout certain communities, and that introduces another facet to the strategy. It means we're entering a new phase. So in this situation, organizations have competing priorities. So on one hand, folks will have to continue to focus on the things that we just talked about in that reopening and recovery phase. So meeting volume growth targets, responding to pent-up community demand for healthcare. And on the other hand, at the same time, you now have to re-enter crisis management mode. So that's going to require folks to shift their protocols and policies again and potentially scale back some services. And if we think about that on a more micro level, this is, the beginning of what is expected to be ongoing localized volatility. So for a single market, as you see here on the left represented, you could expect that, as new cases drop, volume ramps up, and then assuming you have a way to monitor community wellness, you can keep an eye on new outbreaks and monitor capacity to respond. But then the outbreak occurs, and that will force you to rethink your business model across the entire hospital. So things like, where do we use the most PPE, for example? Do we need to scale down those services where we use a lot of PPE to manage the surge? And so a lot of questions will emerge. And to manage that kind of business ripple effect long term, there are a few competencies that will be extremely important on the right. So first, organizations are going to need to create staff efficiencies. One way to do this really effectively is by engaging your patient population using automated triage, automated education, preparation, and recovery communication tools. So really taking some of that responsibility off the staff. The second component is visibility. So organizations will need visibility in order to prioritize patients for care, put them in the right care setting. They'll also need that visibility to identify outbreaks and get ahead of them. That said, you can't check on every single patient every day by calling them up. There's not enough resources, and so remote patient monitoring becomes really key here. And then the final competency I'll call out is, organizations really shouldn't lose sight of the importance of patient loyalty during this time. So with the introduction of remote care, geographical limitations on patients when they choose providers are just gone. So if your organization can't get me in, I could seek care via telehealth just about anywhere. Obviously there's still network restrictions, but it's a much broader group, and that creates a lot of opportunity to grab market share for providers, but it also creates risk. So if your services are not accessible, if you're not reassuring patients that it's safe, if it's not easy for them, patients can go elsewhere for some of those services. So all these competencies are absolutely doable, and organizations are, making these technology investments to try to build these out. Let's just take a quick look at what that looks like. So when we think about what are the technology pillars necessary to be successful, and we look at early investment efforts, they seemed to have focused on across the board tools that allow for a one-to-one treatment replacement, where patients are being engaged in kind of a single moment in time. You can't provide care in person, so you swap it out for a telehealth visit. The most common combination was use of initial symptom checkers, whether that be via chatbot, e-visits, online form completion on the portal. These are all helpful in determining if someone should either get tested, continue to monitor, or see a doctor. And then for patients that needed an actual face-to-face interaction, telemedicine obviously comes into play. Folks are using video visits to do that one-time assessment. And these two technologies are extremely important. They're helpful, but unfortunately, alone, they leave a lot of what I call in-between time, represented here on the screen, where patients are somewhat just sort of on their own. So, at best, a patient might get a one-off portal message or an email, but even those are flawed because of extremely low portal adoption rates. And so the virtual experience becomes very fragmented for patients. And because their situation is changing daily, it creates anxiety and really impedes their ability to self-manage. And if we think back to those three competencies that we talked about on the previous slide, this combination of tech really leaves a missed opportunity to create staff efficiencies, because if you think about resources required for preparation and follow-up here, they're hefty. It also doesn't allow for visibility outside of those single interactions. So visibility is not being created. And then finally, it's not driving loyalty, because as I mentioned, this is a fragmented experience for the patient that is not easy and in no way helpful. So what is missing here? What could be added to this in order to really kind of streamline the process? The missing technology pillar is ongoing digital care management and remote patient monitoring in combination. And that's exactly what the GetWell Loop solution provides. While those first two categories are, of course, very important, they really need to be combined with some kind of underlying engagement mechanism. So by regularly engaging patients in a digital way, you can actually start that relationship building long before symptoms even develop. So for example, we're using digital care management through the GetWell Loop tool to educate folks in this worried well category, which we'll talk about later, just to monitor them for symptom development. And then if they develop symptoms, we can triage them to the appropriate one-time assessment mechanism. That engagement then continues along the entire patient journey. So patients are continuously assessed, they're continuously guided. As their individual situation changes on a daily basis, the organization can respond. And this is the type of support that is going to be critical in managing that ongoing volatility. So as a bit more background on the GetWell Loop tool and how we've partnered with organizations to respond, this is a digital care management solution that folks are using to engage with and monitor patients anytime they are outside of the four walls of the care setting. The GetWell Loop program has been around for 11 years. They have a library of over 180 episodic specific care pathways, and all of those are kind of fair game for the patients to be assigned to. Once a patient's on a pathway, the tool really does three things represented by the columns here. So for the patient in that first column, the Loop tool is sending automated daily check-ins that include a combination of education, reminders, tasks, and assessments that are really keeping the patient informed, calm, on track, and also, of course, monitoring their progress. And when that assessment indicates any sort of concerning signs or symptoms, then the care team is automatically alerted so they can intervene. And so for the care team, there in the middle, it really provides a real-time window into what's happening with the patient. And because of that, if you look to the far right, because it's automated, because it will alert the care team within their workflow when they need to jump in, they are actually able to kind of shift and focus their time fully on patients that need intervention, allowing organizations to really drastically scale their resources. So you can kind of think about how this would have been valuable for COVID. In addition to kind of the functionality, the content is equally important. So as I mentioned, we've been doing this for a long time. We put 11 years, millions of dollars into the development of our engagement expertise and assets. And a big part of that is the content. In 2019, we did just under 95,000 digital patient check-ins per month, and that's of course higher now with COVID. And these care plans are offered across 18 service lines that you can see here. They include pathways for chronic, procedural, and general discharge management, as well as now COVID. And an example of one of those service line care plan lists is to the right for orthopedics, if you're interested in kind of understanding what types of plans are here. When COVID hit, we quickly applied our expertise across multiple departments to think about, how do we use the Loop tool? How do we build out COVID-19 specific content and pathways to add to this list? And we did. And when we were developing those care plans, what our team did is they actually recruited a clinical advisory council of clinicians from across the country. They rapidly developed the plans, and these plans were designed not just as symptom checkers, but really as kind of full-scale whole person engagement plans. So the content is designed with education and monitoring that engages on a clinical, a behavioral, and a social level. From the clinical perspective, up-to-date education and symptom tracking was of course prioritized, but then there was also these other two pieces. So on the behavioral front, the focus was on things like, helping patients improve their capacity to engage, building resilience, building mindfulness, or supporting folks in developing their ability, to cope with this, and then also driving patients to the right resources during the crisis. The social components are also incredibly important and unfortunately often overlooked. Here, the content was written using a very empathetic tone. It was written in an accessible literacy level, which is so important when we think about engaging some of those difficult to reach communities. And then it was also designed to identify unmet needs in the population and alert the care team of those. All of this content, as it was being kind of pulled together, it was validated, it was peer reviewed by that panel of experts, and they continued to review it weekly and actually updated. There was a kind of a single person that was responsible for updating it daily with any evolving guidelines from the CDC or WHO that may change. After months of doing this, so engaging patients through these longitudinal pathways, we'd obviously collected a ton of information, and that advisory council actually aggregated that information, and they pulled clinical insights from it, and that's what you're seeing on the far right. So for example, they found that females were actually 28% more likely to report loss of smell or taste than males. And those insights are interesting and helpful, and they're available to our clients as a part of our partnership, and they're being used across the country to really improve our understanding and treatment of COVID-19. As for the actual pathways themselves, they can be broken down into two categories. So now we're looking back at that, strategy map that we showed before, and I'll start on the right actually. For active crisis management and now reemergence and surges of COVID-19, we developed care plans on the right that are designed to actually monitor and support patients from early concerns through recovery directly related to COVID-19. We also recognize, as we discussed earlier, that COVID-19 patients are not your only patients. And despite the surges, organizations are still kind of caught in this reopening and recovery phase where, in other service areas, so outside of the COVID-19 response, you gotta still serve those folks. And so we also developed content enrichment packages that actually layer onto our existing care plan library and include COVID-19 information to help minimize disruption of care across those service lines. So, as we talked about earlier, when you have to change a protocol or use a policy or scale down service, you have to communicate that. And this is a great way to kind of layer that into preparation that already was coming through around the procedural care or whatever care that you're providing or layering that onto. provide a bit more detail on the care plans, the COVID-19 specific pathways, so those that would be used during reemergence, surge, or just active crisis management, they include an active symptom or exposure care plan in the top left. And this was designed to monitor patients who may have or may develop the virus, so high-risk patients, exposed, maybe tested positive. There's also a pediatric version of this care plan, and the focus is, of course, on self-quarantine, symptom reporting, really making sure these patients don't escalate. We also developed, just right of that, a self-monitoring loop. And this is for the worried well patient. So these are for folks who might be looking for information and guidance. They're not high risk, they don't have symptoms, but they want to stay connected, and they also want to know what to do if they do start to experience symptoms. In the bottom right, we also developed a recovery care plan. So this is for patients who may have been discharged from a COVID-19 related hospitalization. They are recovering at home, and we are really monitoring and supporting them and kind of assimilating back and assuring them they're going to be okay, and making sure that in the event that any of those concerning symptoms arise, they are well connected and supported and able to get the help that they need. And then finally, in the bottom left, we recognize that employees are putting themselves at risk every day in hospitals to support the response effort. And so we offered hospitals and healthcare systems a healthcare employee care plan that was designed for employees that are self-isolating due to active symptoms, exposure, or maybe they were even diagnosed, so that those employees can be monitored and supported, but also so that organizations have visibility into their recovery, can manage against guidelines on returning to work, and of course, manage their staffing levels. On the other side is, the plans that are not COVID-19 specific, but include COVID-19 information that's layered into other pathways. So these can be layered onto any of our existing care pathways, and they're all designed with specific goals in mind. So on the far left, we have our general education and content package. When this is layered onto our surgical care plans, it provides patients with all of the up-to-date information that they need regarding COVID-19 in preparation for their surgery and also during recovery. We also have clinical screening content packages. So this was really designed to automate the screening process prior to any sort of service or patient coming in. Around surgery, this is specifically designed to prevent cancellations and transmission. So we heard from many of our clients kind of horror stories of surgical cancellations right after reopening, and so this is really designed to mitigate that. And then finally, we have the reassurance content. This package provides facility-specific guidance on what to expect for patients when they arrive. And so again, it's, how do we reduce anxiety? How do we make sure that the folks are prepared so that we don't see those cancellations, et cetera. This work has gone a really long way to make patients feel safe and prepared, and reduce the effort that care teams have to actually devote to making patients feel safe and prepared. And as you can see here, patients really appreciate this approach by their providers. So a common theme that we hear in patient feedback is that they feel supported. They love that they have access to their care team at their fingertips, and as you see on the far right, it definitely reduces anxiety. Clients love the tool as well. So if you look at the quote in the bottom right, we had one organization write to us and actually share that they had patients from other health systems saying that they planned to switch providers because they were so happy with the service. Similar results were actually published in a recent manuscript by mHealth Fairview that you'll see on the slide here. They found that GetWell Loop tool was very quickly accepted by both patients and staff. They saw a 94% utilization rate, phenomenal reviews, and again, we've included a quote in the bottom right, really articulating, I think, well, that the mHealth Fairview team was doing a great job responding to the alerts that were generated, and that they felt connected and well supported. So I hope that information was helpful. I'm actually going to pause here and walk you through a quick demonstration of the tool just to bring this to life for you and show you how it works. So I'm actually going to start with activation and just provide a quick demonstration of this. So patients can be activated a number of different ways, which we're happy to talk with you about what might be best for you if this is something you're interested in. But their activation invitation comes in the form of an email or text message that looks a little bit like this. So we'd like to use GetWell Loop to stay connected with you and provide you with the best possible care. They are then confirming their birthday to make sure that we have the right person. They are selecting a username and password and agreeing to terms of service. And then they're confirming their contact information. And I think something that's really important here is they can also tell us how they prefer to be notified. So, when there is, for example, as you can see here, important reminders from their provider or messages, do they want those via email or text? I'll say text here. They upload a photo and they are finished. So very, very simple activation experience for the patients. Once the patient is activated, I'm going to walk through a quick example of what one of these daily check-ins looks like. So this is a COVID-specific check-in. This is from the active symptom monitoring loop. And what Catherine would receive is either on the app she can download if she wants. We also have email she can get this in, or she can get it via text. She's gonna be able to kind of see this notification. Hey, Catherine, just checking in. We've got some new information for you today. It's time for your check-in. The check-ins are pretty short and sweet. They're designed to, again, educate and inform the patient, but also assess their wellness. So this is the first check-in, so it's a little bit longer, but we're letting Catherine know, hey, you're safest at home. Welcome to the loop. We're gonna help you stay healthy. We're gonna monitor you. This is what's going on here. We are also sharing some very basic education information. Education can come in the form of videos, pictures, diagrams, paragraphs, bullet points, whatever makes the most sense in this particular care pathway. We've included an infographic on our emergency warning signs to watch for. And then we're also going to ask some questions about the patient that just help us get a better understanding of impacts to their care. So for example, and this goes back to that social and behavioral component of these pathways, we are asking how many people live in her household. We're asking if any of these risk factors apply. Do you have a weakened immune system? Are you experiencing any of the other components, just to get an idea of these, whether or not she has a risk factor? I'll say no. And then we ask about symptoms. If you're experiencing symptoms of COVID-19, when did they start? So we're kind of getting a baseline understanding of where she's at. We're also asking if she feels anxious or nervous. So again, a whole person health, we want to know what this patient's experiencing. And then we kind of pause here, because prior to that point, these things change every day and they're kind of on this longitudinal care pathway. But every day we're going to walk through a checklist for COVID-19 symptoms, and we're letting the patient know in advance, hey, we're going to do this every day. It's going to seem a little long at first. You can see we're doing a little bit of expectation setting, but other days it will be faster and it's important, so let's do this. In that symptom check, we're asking about shortness of breath. We are asking if they have a pulse oximeter, or if they're checking their oxygen levels. If they are checking their oxygen levels, then they can actually free text type what their blood oxygen level is. We're asking them to check their temperature, and we're also giving them some education on the appropriate way to check their temperature. If they do not have a thermometer, they have the option of letting us know that. So again, kind of identifying some of those limitations for certain populations or people. And then if they are checking their temperature, they can also enter that free text. So as patients kind of go through this on a daily basis, again, being kind of educated on what they need to be doing, et cetera, it helps provide that visibility that we talked about earlier, and really give us a sense for how these patients are doing. And then we can use this data in aggregate to look at populations, but also on the individual level to make sure these folks are okay. Final question we're asking in this very first checklist, again, this is one of the longest ones we have, is, hey, thanks for finishing this. You seem like someone that cares about their health. How often do you actually think you'll be able to check in? And so we get a sense for like, how often can we actually expect to get information from this patient? And then they're done. So that's kind of a basic example of a check-in. We're also providing to patients through the platform a sort of home base. We call this our activity feed. And it's a basic look for patients at any of the education or information that we've sent on previous days. It's not repeated every day, it's different every day. So if they want to go back and rewatch a video, they can. They also get a checklist of things that they need to be doing. And then on the far right, you'll see a resources tab. And the resources tab is really a place for any additional content that might be valuable. And so you'll see we have fact sheets, caring for yourself at home, a lot of information here that patients can access through that resources tab. So I'm going to jump out. That was a COVID specific patient. Let me jump over and show you, what would happen with the content enrichment. So let's say that you were managing a total knee patient. And I'm going to show you, how a check-in would look for a total knee patient to help them prepare, including that COVID content. So if you layered in the screening content specifically, here's what a check-in would look like. So again, basic introduction. And as you can see, first thing we're asking is, have you been tested? You can let us know. Have you had contact, traveled to a high-risk area, tested positive? So these are all of those typical screening questions. We are alerting them that there are some symptoms that do require emergency treatment, letting them know what those are, telling them to call 911 if they have them, and then telling them what to expect next related to their surgery, which is important, really setting expectations, including things about visitor guidelines, for example, telling them, hey, it's now the time to start planning who can drive you, who can help you during recovery. So this is many days before the surgery. And then we're also asking them, hey, can you check in every day before your surgery? So we want to monitor those symptoms and make sure that we're not bringing folks in for other areas of service that are going to spread the infection. So then again, here they do that daily symptom check. Assuming they have none of those symptoms, then they're done. So very easy way to kind of layer content into other plans that we have. Final thing that I will plan to show within the demonstration is the clinician experience. So I won't spend a lot of time here. It's highly configurable to our client workflow. Everybody looks a little bit different. We do have a dashboard that the clinicians, whether that be nurses, care managers, nurse navigators, physicians are using to manage patients. So I just signed into this. In the back end, they do have kind of a basic dashboard here on the front page where they can see kind of a high level view of the population. So, what's patient status by alert, what's overall engagement. So we do track and monitor engagement. You can monitor patients here. You can look at response times across different team members. And then if you have a patient that alerts, they would show up over here in the inbox. So you can see Catherine is getting knee replacement. She's alerted here. Looks like she has, this is a pre-surgical alert. She has a skin abnormality near the site of her procedure. So maybe she fell, hurt her knee, I'm not sure. But this is something that needs to be addressed. And from here, care team members can comment directly to Catherine if they want to ask her more questions or give her instruction. They can also hand this off, so they can push this to another member of the team. And again, this is where a lot of the workflow configurability comes in. We're happy to talk more about that. If you're interested, they can take internal notes, and then they can also bill time here. So, organizations are being reimbursed for use of GetWell Loop through or using remote patient monitoring codes, CPT codes. And so you can select the code and log the time, take notes, submit that, and that allows you to kind of track the time so that you know when that patient has hit that necessary reimbursement threshold. And if I come up to the top on that billing component, there is a billing tab here that allows you to see who actually is eligible for billing so that you can do that. If I jump back over into the slide presentation, now that we've done that quick viewpoint, this is just a picture into the specific codes that are being used to bill for the use of GetWell Loop, and then the reimbursement averages that our clients are seeing for each. And again, happy to discuss this further with anyone that's interested. So I hope this information was valuable. As far as next steps or how you would get started partnering with us, if you are interested in learning more about the platform and about how we might be able to support your organization, schedule a discovery conversation with us. We'd love to talk to you. We are providing these services well below cost with no ongoing fees. And we've been able to find a way to work with every organization who has come to us needing support. So we'd love to chat. I'll also mention here that we are also committed to a very rapid implementation. Implementation timelines and needs really depend kind of on workflow, but we have been able to implement these as quickly as 3 to 5 days. So if you are in an area that is surging and you need the support immediately, please let us know. And on that note, I will just say thank you again for your time. Thank you for all of the hard work that you are doing in the community. If we can help, or if you'd like a copy of these slides, you can email covid19help@getwellnetwork.com, and someone from our organization will reach out and make sure that we are getting you what you need. So I hope you have a wonderful remainder of your day. Stay safe out there, and thank you again.